We're about to go live. Just let you guys know. Oh, is that going to go? Okay, we will call to order the Broadwater County Board of Health meeting. Today is June 16th. Hi, everybody. Nice to see everyone. Thanks for coming. All right. We'll start off with any public comment for items under the board's jurisdiction and not on the agenda. So any public comment for items under the board's jurisdiction and not on the agenda? Anything? Anybody? Okay. All right, we're going to go ahead. First item, minutes approval. These minutes are from January 27th, so it's been a minute since we all got together, I think. Time is flying. Did everybody have a chance to review minutes? Yep. Okay, is there a motion?
I move to approve the minutes as written.
Second?
I'll second.
Okay, perfect. All right, there's a motion and a second to approve the minutes from January 27th. Is there any public comment? Any public comment? Okay, hearing none. All those in favor, please signify by saying aye.
Aye.
Aye. All those opposed, same sign. Motion passes. Okay. Daleen, there's a spot for you to sign on here.
Okay.
Okay. I'll hand this down to Daleen, please. Okay, so bylaws. They are the gift that just keeps giving. I know, it's never ending. We did kind of revise the format. So when Ruby and I and Tiffany and Emily were at the Board of Health Confluence training, and that was April, which again seems like 6 months ago. When we were there, we kind of went over some things. They discussed a lot about bylaws. I just updated our format so it wasn't so out of date. I know we had signed previously, there was just two of us. We can get, I'm going to sign, I'll get Emily to sign tomorrow. She's able to sign. And Daleen, secretary or admin assistant, and then the county commissioners will sign. I haven't changed anything. It's still the same copy. Just want to make sure everybody's good with that. We just updated format. Next year, I think we can add a couple things and maybe look at these more in depth. They had some suggestions on bylaws, but really keep it simple. It doesn't need to be too complicated, and that's something we're kind of looking at doing with all the board bylaws. It's just a little bit more standardized format, keeping it more simple. So, yeah. We'll get the complete signatures on these if everybody is good with that. We don't need a motion. These we've already moved to approve these, and I'll just finish those up tomorrow. I'll get Emily to sign them.
Okay.
Daleen, will you remind me of that, please?
Okay.
Thank you. There might be one or two things going on. All right.
Madam Chair.
Yes.
Madam Chair, was there anything that was really highlighted there that we needed to make pretty aggressive changes or things to do right away?
Yes.
As far as bylaws?
Oh, as far as bylaws go. No, I don't I think the biggest thing was we do have to meet minimally once a quarter. Is that right?
Yeah.
Is that what I said? Once a quarter.
Title 50, Chapter 2.
So I had printed out this Montana Code Annotated Title 50, Chapter 2, 116, Part 116, and then also the 52 and 130. You're more than welcome to do some light reading if you would like. But really, that was hold regular meetings at least quarterly. And I think we're pretty good about doing that. Sometimes we kind of kick it a little bit because there's not much going on. But I think with some of the other stuff we're going to talk about today, there'll be a reason for us to meet, even if it's there's nothing major happening. I can send these to you guys just to have for reference. I mean, it's not fascinating by any means, but boards of health have a lot of power to do things. And so, I didn't quite realize, I mean, they can set a lot of policy. There's a lot of things the boards of health can do with the commissioners and on their own as well. So, but nothing immediate that we need to change in bylaws. All right. Did you have anything you wanted to add to that?
No, I think that's good. I think we can work at it as we work forward with the other things.
Okay, perfect. Ruby, did you have anything you wanted to add to that? Since
No, I think that the bylaws were fine. I wasn't super
Okay.
concerned there.
Okay,
Sounds like it was a
Just
good
the meeting
conference.
quarterly, that was the only concern.
just
I had.
make sure we're meeting at least
Yeah.
quarterly. And we do have in our bylaws when our meeting days are every other month, but sometimes again we kick it, and so we need to make sure we're getting
At
the
least
minimum
once a
in.
quarter.
I'm sure when something like COVID happens, it's probably not a problem.
Yeah,
Well,
well,
and I think that
going on.
that's why we got so lax on that too, was COVID kind of burnt everyone out.
Probably.
And there were a lot more Board of Health meetings, and there was a lot more consistent seeing of each other as a
Mhm.
Board of Health at that point in time. And so I think it just got to the point where we were like, oh, we don't have to be in a state of emergency, so.
Yeah.
And then you forget about the regular rules
Right.
that are just hanging out there.
I forgot to tell you to come up and talk up there. But you're up next anyway. Oh no, I'm sorry, Megan's up. You get to come up. Thank you. All right, Megan Bullock, Broadwater County Sanitarian Environmental Health Department update.
Good afternoon. You should have received a copy of a status report for the environmental health in your packet. That was up to May 19th for the last meeting. I did not update it, but I can tell you that as of today, I'm 63% done with establishment inspections and doing lots of site evaluations, septic inspections, DEQ submittals, so staying busy. So unless anybody had specific questions on the report provided, there really isn't a whole lot to report.
It seems like the, if I say this wrong, I'm sorry, the Montana Local Food Choice Act is causing some just
Actually,
confusion.
that has calmed down now.
It has, okay.
Yeah, that was a little rough for a bit. The establishment that I was struggling with did get licensed, and the people who are selling their product through that store are one by one coming in and finding out what they need to do to comply.
Okay, good.
It's unfortunate. It's a crazy law, but Montana Local Food Choice, they need to sell directly from the producer to the consumer, not through a third party, and definitely not through a retail store. So they can do it. There's just restrictions.
What was the law before that? What did the law say?
We have the cottage food, but it's for non-potentially hazardous foods, so nothing that requires refrigeration.
Okay.
So it's mainly your baked goods. And we still do have that where they can get registered to be a cottage food. And then prior to that, you just couldn't do that. You couldn't sell food that you cooked out of your home kitchen.
Okay.
The Local Food Choice Act kind of opened it up. And crazy as it is, you can do pretty much anything out of your home kitchen under Local Food Choice, with exception of foods that have meat product. Except for if you raise chickens, you can use chicken. So you could theoretically make chicken enchiladas in your home kitchen and sell them. So it's a little scary, but
Yeah.
there was a bill before the legislature this year to even open it up a little bit more and allow those people to sell their raw milk, all those things covered by Local Food Choice. They could put it like at a grocery store in the back area where it wasn't accessible to customers, but it could be kind of a drop location and for people to pick up. It did not pass though, so it's a tough law. It's tough to interpret. It's tough to enforce.
What is the penalty on that if someone gets caught selling food? Just out of curiosity?
Well, I believe it comes down to a misdemeanor, and there's like a fine per day, and each day constitutes a new violation. So it's not a lot. It's like $10 a day or something,
Just
but there
adds
could
up.
be imprisonment too.
Oh,
It's
nice.
and or fines and or imprisonment.
Okay.
Yeah, so not a fun one. So I definitely stirred the troops in Townsend. If you heard about it, it was not fun. Just doing my job.
Yep. You know. is this busier than last year?
Boy, it sure feels like it, but I don't know that we've issued as many. We are at 38 permits issued since January 1. So septic permitting, I don't know how it compares to last year. I think it's probably not as many. Probably close, though.
Okay. Great. Thank you.
I have a question.
Yeah.
Megan, I guess this for my information on this young man that's selling snow cones. Does he have to get a license?
He did,
He did?
actually, yes.
You know, I just like to see young people trying to make doing something like that. What does a license cost for a young guy?
So that was a tough one. I tried to find a way to say yes. So I did bend the rules a tad bit. But the problem is that if he were doing it as a local nonprofit, there would be no license fee.
Oh,
If he were doing it under local food choice, he'd have to make it in his home kitchen, and then he could, well, you can't do that with snow
snow
cones.
cones.
No, it's absolutely crazy. And then there's such thing as a temporary license, which is what we ended up doing. And this is where I bent the rules some, is that under state law, you can only do that for 21 days and connected with an event. And so obviously that doesn't fit either. And so rather than say no, he did get licensed, which is hard because it is an $85 annual license.
Oh,
But
yeah. He's just doing it for the summer. Yeah,
so I told
know
him it was a good lesson in budgeting.
I was just gonna say,
Yeah.
it's a good, yeah.
Yeah. Well, I just like to see small town young people out there trying to
I agree.
do things and
I agree.
Yeah.
It's tough, but I did license
Yeah, oh,
him,
good. Okay.
made sure he had things for hand washing
Yeah.
and, yeah, so his mom understood, and they're going to do the summer on that one
Yeah.
permit, so,
oh, good.
yeah.
We are always the bad guys. It's never
Yeah.
fun.
Well, it's just a good story.
I
just like seeing
know.
it.
I have to pick and choose what I'm
Yeah.
willing to go
Yeah.
to jail for, and that was one.
Yeah.
Well, thanks for kind of.
Okay.
Yeah,
I know
that's
the
good.
hospital supported him through that $85 fee, so.
Yes. Oh, good. Okay.
Oh,
So you're like,
I
oh,
always feel
man.
terrible.
I know.
Yeah,
And then
that's
once
good.
you see it, you can't unsee it, right?
Yeah.
And then you can't really
Yeah.
turn your,
Yeah.
But that's what I said. I'm like, I hate it because you see kids doing lemonade stands
Yeah.
and you know, things
Yeah,
you want them to be
absolutely.
successful and
Yeah.
You know, the local 4-H groups, all of those, we just do a little temporary permit. There's no cost to it. I think the main thing is being able to visit with them and making sure they understand that they have to wash their hands,
Yeah.
that they have to be careful. And snow cones is so low risk, I wasn't
Yeah.
overly concerned about it.
Well, it's a good lesson for him.
Yes, yeah, it's a tough one though.
yeah, it's
So.
good.
Thanks.
Thank you, Megan.
No more questions? Okay.
All right, now you're up. Ruby Taylor, come on down. Public Health Director, Department Update.
So as far as department update goes, we're kind of just holding steady right now. We did our bike safety rodeo, which went well. It was a lot of fun. It was better attended than it was last year and better organized. So I was pretty proud of that. So it felt better this year in general. And part of that was maybe because we were back at the park versus at the football field.
Mm-hmm.
And my brain says the park is better, so that means it went better. But overall, I felt like it went really well. We were able to give out 6 bikes, 3 of which were donated by local local businesses in town, and we had like $500 or $600 in donations from local businesses towards store prizes and snacks and that sort of thing for the kids participating. So that was super awesome, and we're very thankful. So we put a thank you in the paper, and I've been thinking about doing like a thank you card and sending it out to anyone who donated. So I'm going to talk to Diane about that. But
It's a good idea.
that was our big thing that was going on in the last couple months. And then we went to Confluence with you guys and did the Board of Health training, and then just Confluence in general. I sat on a panel for the Casper survey that we did last year, and just kind of talked about how that went and the planning of that and that sort of thing. So it was nice. It was good to just give that information out, and it was good to tell other counties what we learned from that experience, because it was interesting, and doing it as a tri-county effort was a lot of work, but definitely is the only way we were successful in gathering that data, because we had a lot of people from state coming and helping us and CDC coming and helping us. And so without those people, it would have been myself, Jenna, and my mother-in-law going out and getting surveys. And
Yeah.
that's a lot.
Where are you at with the CHA and the CHIP?
So the CHA is done. I have it. I just need to send it out to you guys, which I totally forgot about. So I will get that to you. It's all the data's compiled. We have a final CHA document, and I just need to publish it and get it out to the community so people can see it.
When you say you guys, you mean like Board of Health, or do you mean commissioners? What do you mean?
All of the
Just
above.
all of the, okay.
I just need to get it out.
Okay.
And I have not yet. And then the CHIP we're still working on. I was waiting for the hospital to do their community health needs survey, but it sounds like there's maybe some delay on that, so I'm not going to hold it up too much, and I'm just going to start working on the CHIP, but I have to get a hold of Megan at State and see what my next steps are for that. And the CHIP is the Community Health Improvement Plan. So
you use the numbers from the CHA.
yep, so we'll
create the CHIP.
identify, I think it's 5 of the top concerns identified in the CHA, and use that to build our CHIP.
Okay.
So,
Ruby, and I'll be your point of contact for that, because Emily's moving out of infection control and quality.
who does she think she is?
All right. So, anything else for your update?
No, nothing else on my update.
Okay. Since you're there,
Hey,
we have you up for a discussion decision review and sign laboratory transport plan checklist, and we have one more after that. But we did not print these out because they were large documents.
they're ridiculous, yes.
Yeah.
So the laboratory plan checklist is smaller. That's the one that I did fully update last year.
Okay.
So I have no concerns about the laboratory, the all hazards laboratory transport plan is what it's called. I went through it. I added pictures of all of the sampling kits that we have, descriptions, locations, protocols, who's supposed to be getting the samples, what we're supposed to do with them, how to contact the Montana Public Health Laboratory, and all of that. So that plan is primo. Very happy with it.
Okay. Then we have we can talk about this other one, and then we can go back to signing.
Oh,
The discussion decision review of the pandemic influenza and communicable disease response plans.
yes. So that's the promulgation page, I think is how you say it.
Okay.
And this one is the one that I emailed out to everyone last year to look over for me. And I have not made any significant changes other than taking out like specific names for organizations of people to contact, because if you have names in there, you have to change them every 2 minutes, it feels like. And just updating, like the names that I did put in there were like myself, my medical director, and there was one more. Oh, sanitarian for one of them. So I didn't get a chance to go through and truly update these this year. It's super in-depth, and after talking to the FEP crew at the state, I think what I'm going to do is kind of just trash these and get a new template going that bulks down our current plans. Because these are workable plans. We could use them in a pinch. However, they are 55 and 48 pages long. Ain't nobody in an emergency situation going to sit down and read 48 pages of nonsense. And the first like 15 or 20 on the pan flu plan specifically is just demographic information for Broadwater County that is no longer correct. So it's a workable plan. We can use it if we needed to, but I'm going to make it better. So we just have to say that we looked at it, that we know it's there, and that we can use it if we need to.
What do you need to do to make it better? Like what?
I need to shorten it, and I need to like take out all of that demographic stuff that we don't need in there, and get it to where I don't have to update it every single time someone changes a position or does anything like that, just so that it's more user friendly. And I'd like to do like an appendix in the front that has like a quick reference guide that's just a one-pager that you can look at, get the gist of, and then if you need to reference more detailed things, you can go into the plan. So state is going to help me with that and get that sorted.
They are.
Yes.
Okay, that's not something you need Board of Health to help you.
No, not necessarily. I mean, it would be nice to have your guys' input because essentially it is going to involve Board of Health. But I can do the bulk of it with state's help and then bring it to you guys to look over.
Okay.
So if there's anything glaringly crazy in it when I do it, you guys can steer me in the correct direction. But
Okay.
the plans are my least favorite thing because they are important and I don't want to do them incorrectly because I would like them to be useful to us. And so I have a hard time getting the nerve to sit down and really break those down. But Jerry at the state was like, no, call me. I'll come down or we can sit together or whatever. We'll figure it out. So
Is that something that's supposed to be done annually? Just,
yes.
Yeah.
So the big update is like maybe once every few years, but we're supposed to look at them and know about them annually. So the promulgation page is basically just saying like, we looked at the plan, we know it exists, we know who we can call to get it, and we know where to find it. And they know how to distribute it and deploy it if needed. So
I think it'd be a good idea to work with the state and then bring that to Board of Health and just have something that, I mean, if we're all going to be involved in these plans, like should something happen, we would definitely be
yes,
involved.
exactly.
So just, maybe that's like annual business at the beginning of
Yes.
the year. We just kind of review those types of plans and things that you need.
And
review.
ideally that would be what
Yeah.
we would be doing because they're also deliverables for my FEP grant to make sure that we have them. And so like that's why I need this signed so that I can send it into FEP to say like, yeah, we looked at it, but yes, we looked at it and it needs work is more of a us thing than it is a state needs to know. And state already knows because I'm very honest with them.
When do you plan on working with the state on this?
I'm hoping to start it up first quarter for next fiscal year. Because it's an any quarter deliverable, so I can do it whenever. But what I did this year, because it was my plan to work on it this year, was I was like, oh, that can wait till next quarter, and now it's the last quarter, and it can no longer wait. So I want to start it first quarter next fiscal year so that I have plenty of time to work on it and at least like have a solid game plan going.
So it's something like around October, we could probably start
Potentially.
start reviewing and helping you with finalize, and we'll have it kind of good for the new year.
Yes.
Okay, that might just be something for our annual stuff. Just help you get plans reviewed. Then we know what's going on too,
Yeah.
which helps to see those.
Yeah, and it's important that we all know those and like there's tabletop exercises that go on that show us that we can use our plans and that sort of thing. So I want to get them updated so we can practice because the only way we're ever going to get good at any of this is if we practice situations in which they are needed. So
Did any of you have any questions or thoughts?
Are you still doing COVID immunizations?
yes, we can get them. We just had a box expire. We had 8 vaccinations left in it, so that was a bummer. Because the COVID vaccine, we do not get reimbursed for unused doses. That's just a loss to us, so that stinks. But we can get it, and we have stable supplier of it, I guess is the best way to say it. So if someone needs theirs, they can call us and we'd be happy to get it for them.
Yeah, you can just order it for them. Yeah, okay.
We have to order 10 at a time, so I would like to have 10 people,
Oh,
but
yeah.
also I'm not going to deny someone their shot just because it stinks for my budget.
Right.
So
Wow.
I will make things work.
Yeah.
Okay, I'm gonna get these two signed for you, and then will you let us know, like, next meeting where this, what your
Yes.
status is? Because next meeting, what, is June? Gosh, well, so August
August.
should be our next meeting.
Yeah.
And then bring it in October.
That's what I'm thinking.
Yeah.
Okay.
I will work on that. That actually is better for me because I work better with deadlines.
This says country commissioner, by the way.
Oh, I didn't type that
No, I didn't think
promulgation
so.
page.
That's kind of funny, though.
The good old state did.
Nice job, Ruby.
Those FEP people, they crack me up.
Well, thanks, Ruby.
Absolutely.
Appreciate it.
Thank you. Yeah, country commissioner. That's just gave me a promotion.
I mean, you want to be the country commissioner.
Sure don't.
And then my question on this one is, who do I have signed for LEPC now?
Mark Wood.
Okay.
Probably because the sheriff's, so this is also just some extra information. The sheriff's office is now,
RDES.
well, they are supervising DES.
Okay.
So Brittany has moved away. She, or she's in process of moving. They are, we were talking about that anyway. It just makes more sense to have the sheriff's office. I mean, they've got the radios, they know what's going on, just better than having commissioners supervise that. So at the time, they're kind of obviously dealing with a lot of stuff right now. So I think Officer Reynolds, since he's on light duty, is helping just kind of bridge that gap for now.
Okay. I'll email Mark and just see where he wants me to bring it, and I'll get him a copy of the plan. And because I don't know that they've ever seen it,
Yeah.
they just call me if they have weird stuff to send a sample on.
Okay. And that looks like Doc needs to.
Mm-hmm.
Okay. Yeah, and I don't know, like specifically for LEPC with Brittany leaving, who the chair of that is.
Yeah, I'm assuming it would be Mark or one of them.
Maybe, but maybe it's
Until-
just maybe it could be just DES.
I don't know. It's hard to say.
Or a member of LEPC. I'm not really sure.
Can you have her sign before she leaves?
She already
She's
is
gone.
gone.
Oh, she's already
It's
done.
done. Yeah. We'll figure it out.
Yeah.
Will you get in touch with me about that?
Perfect.
Okay. Thank you. Did anyone have anything else for Ruby? No? Nothing? Okay. Okay. Next item up. And again, be patient with us, guys, because we put this agenda together right after we got back from the confluence in April. So we were fresh. We were fresh on all our ideas at that time. All right. So next agenda is county website, Board of Health page, suggestions for additional information. And I wish I could pull it up right now, but
Yeah, that would be handy.
Daylene, you can't make that magic happen, can you?
I can.
You can? Onto the big screen? Oh, she's good. Thank you.
Yeah, the conference was great in so many ways, but showed us like all the things we could be doing. We're like, oh,
I know. And then you get all these great ideas and
Yeah.
then, you know. Good. Okay, so I think on here what we're thinking, suggestions for additional information. What do we want on there? What else do we want to put? I mean, we've got, basic contact, agendas, minutes, board and committee openings. What would you like to see?
I think it would be really great to have some health education for the county, some stuff specific to us, or maybe even by season. So like summer, we could do some water safety things, and when fire season starts, some air quality things, things like that. In the winter, we can do like conditions for being cold, frostbite, things like that. And then we can also do cold and flu season on there. just tips, like health promotion type tips for the community.
Okay. Is that something, do you see one member coming up with those things and bringing it to the board, or just, hey, each meeting, let's pick one or two things we could put, talk about, it's a seasonal change, what should we put up? What are you thinking that way?
I think we could probably look at it on a quarterly basis or at our bi-monthly meetings at what we want to put forward to the next meeting and what we would like to roll through with our changes. I would be happy to own that if that fits this group on some suggestions. Then we could pick as a group what we thought would be most pertinent to our county and the needs for our community. And then we could kind of keep a ticker on the side and move those items over into like a historical box, but not stuff that we're going to like come up with content here, but using reputable sites like Center for Disease, American Lung Association, cardiologists, things like that to really have some good health promotion.
I think we add it to our agenda, and then on our agendas we can talk about what updates, and if we know that that's coming up at a meeting, we can come prepared with a few suggestions and make decisions on that.
I think the great thing with the conference was that it talked about how it's important for boards of health to have a scope and a mission statement, and using that to build a strategic plan on how we're going to keep our community healthy. So kind of using these as things that we would use from our strategic plan when we get to that this would help support like our growth in our community and our health of our community.
I agree.
A mission statement would be nice right up.
Right on the top.
Yeah, right on the top. Who manages, Daily, do you manage the webpage? Or who does all the work?
It's a shared burden.
It is a shared burden. So I do some of it. I don't know how to do all of it.
Oh,
I can do stuff, like there's a few of us that can.
oh yeah.
Yeah.
Yeah. It's nice to have it.
Yeah, it is. You like the idea of the mission statement?
Yeah,
On there.
there's also what is the purpose of the Board of Health? Yeah, mission statement would be something.
I think that was something that came up, was what did she say? What is your elevator speech? Like if you're stuck in an elevator with somebody for 2 minutes, what is your elevator speech to tell them about what your Board of Health does?
Yeah.
Right.
Yeah. Very nice.
I agree. That'd be a good one.
Yeah, if the public starts seeing those little points of interest, like you said, things will come back and they see something, it's in one spot. And the local paper, it's a weekly thing, but then you kind of get rid of the paper. But if you have a web page, people can go back. And what was that about?
Yeah.
Fire safety or something, and have those articles on file.
Well, you could link to public health,
Yeah.
right? I don't know if that's
And we can make it a simple infographic for the month or the 2 months, and then have that take you to a link. Like when you click on it, it would take you to the next website that would have more information. But like, this is our focus for this 2 months. Like, it doesn't need to be a lot to start, just to get the ball rolling.
Yeah, and like I could share it on the public health web Facebook page and stuff to get it out so that people would know it's there.
Mm-hmm. I like that. I think we could start working on a mission statement. That's something we could do for the next meeting. And what we would like to add on there. So that's something to think about. We can we'll remind everybody. I know everyone is inundated with email at a ridiculous amount, but
I can take a look at some mission statement ideas.
yeah, that would be great.
So do we have Doc and Ruby on that also as the public health? Are they on the contact? Or?
I feel like Doc is not.
I'm on there.
Are you? Oh,
Do
yeah,
you-
there you are.
Do you want to be on there, Doc? As
It's up to you guys.
Yeah, I think it's
fun
nice.
with us, yeah.
Yeah.
So mission statement. I'm thinking infographics.
Yeah. And I'll bring a couple options.
Okay.
And we can vote on what we'd like.
So we can put, we want to see public health, right? What else, you guys? Doc? Do you have a website, Doc, or do you just do,
No,
Just call.
I have a telephone.
that works. That works. Megan, I think you too, environmental would be good. Just links. Maybe we can bring, next meeting, bring a couple ideas. Everybody bring a couple ideas for mission statements and updates. Anything else I think could go on the webpage? There's some limitations by how the format. So like you get into the back end of the webpage and it's very, like there's boxes where you have to put everything, right? It doesn't let you kind of just freestyle it. But I mean, we can add things and Daleen looks excited. But yeah, anything else I think would be helpful? Anything on the maybe non-healthcare type side of it, something
More
more.
of the sanitarian type
Yeah.
stuff. Yeah.
Yeah.
Yeah, where to go. How to get an application. Is there a download now if you want to get an application, Megan, that you can go to? Or?
On the county.
On the county.
environmental
Oh,
health
okay,
site,
on the environmental.
yes.
Yeah, so just basically a link
Yeah.
to you for
we might-
applications. Okay.
Just tie into that if
Mhm.
somebody was looking.
It would maybe be nice to have like a differentiation between public health and environmental health on there, because like we still get phone calls for people wanting like septic permits and stuff. So maybe something to that effect,
Yeah.
like
Steer them to the right place.
Mm-hmm.
who do you need to call?
Yeah.
That might be nice to have on our
Like a
board of health.
nice
Yeah, like a.
Little FAQ.
Mm-hmm.
Yeah.
Flow chart.
Mm-hmm.
Listen, do you do have anything to do with the school?
I inspect the lunch programs.
All right. If anybody thinks of anything, but let me bring a couple ideas back for our mission. Next meeting, we can kind of go over that a little more.
Great idea.
Right. I know. I like it. It's good stuff. All right. Next item. Board of Health suggested updates, inclusions for regular meeting agendas. I think we had discussed, and I'm going to need your brains to help me remember. I know. It was a couple months back. Other updates, because obviously public health gives an update, environmental health gives an update. What kind of updates? When we could invite people in?
The emergency preparedness, when we have that sorted, the county.
Mm-hmm. Yes, that would be
Is the
good.
hospital doing like a health fair,
We just had our health fair,
Oh, did
and
you?
we do it in
Oh.
conjunction with the bike rodeo.
Oh,
and
okay.
we bring in local vendors and try and get our hands around some like healthy options that we have here in town or that are close.
maybe something to put on there, is, healthy happenings or something when the next health fair might be or whatever.
The hospital is celebrating 120 years in the county this year, so we'll have a little open house in August. We'll get you guys the information.
Yeah,
Nice.
that kind of stuff would be good. Any community events going on.
Okay.
Yeah. Healthy happenings.
Healthy
Healthy
happenings. I
happenings.
like that. Did you just make that up, or
Yeah,
was
I
that
did.
something that was just
Just kind of
Boom.
popped in.
Healthy happenings. I'm gonna write that down.
it's all over it. We've got, DES report. I know. I think would be good to add. And just more along the lines of water reserves, or maybe even fire. What would DES need from the Board of Health in the case of an emergency? What's the expectation there? What would the needs be there? But again, I think that's going to take a minute because DES is kind of the interim. What's that?
Figuring stuff out too.
Mm-hmm. Yeah. Okay.
Standing items for anything that needs to be annually reviewed too. Any annual review items. kind of spread them out through the whole year so it's not all at once.
And I mean, I would love to just have, I mean, we kick off January, we know that bylaws are on the agenda right off, just review, check that it is what it is, and we're pretty close. It's not like our bylaws need too much tweaking, but do any kind of like checklist items that we need. Like you're saying, annual items. Okay. Hospital or EMS update? I mean,
We just
for
have-
the agenda.
Yeah, we could add that on there.
Doesn't have to be every meeting.
Okay. Yeah, I'm happy to do that.
Just, they really emphasized partnerships within the community. You've got the hospital, you've got the school, different things like that. Just
Well, could we include the health providers in the county on our webpage? Would that be, or things like mental health or suicide prevention lines?
988.
Just to
Yeah.
do exactly what you're saying, using other people in the community, Brian.
Yeah, we could put some 988 resources and stuff on the webpage. There's also, I've been talking to a company that does, it's through HO.
Oh, come up to the microphone. Thank you. Sorry. I was like, what?
I've been talking to a company through NACHO called Credible Minds, and it's basically like a self-paced therapy online platform, and it does cost money for us to like have it, but it's free for any county member who wants to get on it, and it has like therapy resources, like self-guided therapy resources for like anxiety, depression, all of the things. It's got resources for like suicidal ideation, like if you're in crisis, call this or do this, or like safety planning resources, like that sort of stuff. And so it's a really cool website. It looks like a really cool idea, but it's like, I think like $5,500 for a year's contract with it, and it's yearly. But we have a grant for mental health, and one of our things was to build community resilience. And so I need to talk to our state agency who gives us that grant to see if that would be a reasonable use for that money. Because I think it would really be helpful, because my thought was to do a bunch of trainings in the community, and we can put those on our webpage. And I would love your guys' input on any sort of mental health trainings that you'd like to see in the community, or like input on times that you think people would show up, because the couple times that we've done mental health trainings, no one shows up, and I just don't know how to do it, how to get anyone else here.
No one shows up to meetings. I feel like you almost have to go to an event, right,
And
specifically.
And part of what we're thinking too is trying to get on one of the teachers' Friday extra days that they do, QIR, or whatever they call it.
Yeah.
And doing like youth mental health first aid or something to that effect, just so that we can build the capacity within our community to deal with crisis intervention. So, because having like a on-call crisis intervention team in Broadwater County is not a feasible option, but building our community up to where people feel comfortable handling a situation if there is one, or at least know the resources available to them to get someone help, that would be super helpful too. So the Credible Minds thing I was thinking of, and if we do that, then that'll have a separate link, and we could put that on our Board of Health website, so people can get to it easier, and it'd be on our website obviously, and we could get it out there in many different ways, but having that available to people would be cool.
Yeah. I think that's a good
I
idea.
mean, I'm just thinking about lots of things like domestic abuse, safe sitter programs, first aid, those things. And we don't have to teach it all, but just have a place for somebody to know who to contact or where to go with that.
And we do have a domestic abuse survivors group in town that's fairly new.
Yeah.
So maybe we could give them like a spotlight on our page, or have them come in and visit with us about what they're doing and what they might need
Or
from.
just how to contact them, Yeah, that's great.
Yeah. So there's a lot of cool things happening in town that are just like grassroots, it feels like. And it's just hard to get all of that out, it seems, which is weird because other things travel fast in a small town, but like the nice things are hard to come by.
Seriously.
It'd be great to have the sheriff's department come and talk about the VEL program that they're using for de-escalation.
Yeah, if they're
for suicide management or behavioral issues.
yeah.
Yeah, that would be good.
Yeah. And then like I was thinking too, maybe like a seasonal report from the fire district, like from Ed or someone on rural fire for like air quality or like what they're seeing or anything like that. It doesn't have to be all the time, but like through fire season, maybe check in with us.
We might be able to get a ticker that automatically updates on our site, like what the air quality is.
Maybe, I don't know.
Well,
Can they do that on, do you know?
I have no clue.
I know we have to find out.
I'll help you play with it.
It's so regimented on the back end, but yeah, we can try. Not sure what it looks like, but yeah. Let's
But
do it.
if we're thinking of things to add to an agenda,
Yeah, I like all those ideas.
Yeah, I think those are good.
Before our next meeting, when I send out an email reminder, when Daleen sends it out, we'll just say, hey, remember, we'd like 2 ideas for this, and we're going to look at this, and a little more specific about some things to bring with you. Okay. Anything else on updates or inclusions for regular meeting agendas? Okay. We'll move on. Last item. This is kind of more of our discussion that came from the confluence. Board of Health scope and strategic planning discussion. And we kind of wanted to review that working meeting a little bit. I tried to outline it as best as I could in these notes for everybody. We had the working meeting so we could kind of capture some of the ideas and whatnot that came from the confluence that we could present here. So I think the starting point, and I'm going to say this wrong, strategic plan supports the scope of the Board of Health. Am I saying that right? I think I'm saying that right. So you should all have a strategic plan for your board. That's basically what I took away.
Yeah, so we want a scope of what we're going to like support and cover, and then your strategic plan supports the scope. Like, how are you doing your education? How are you doing environmental health? How are we doing disease prevention? So we'll work on our mission statement over this next 2 months and bring back some ideas. And then the mission statement, the scope should support the mission statement, which is then supported by the strategic plan. So it kind of stair steps through. So these are just kind of some outlined ideas that we got off of that Confluence conference of what a general scope for most boards of health look like. So do you want to just kind of go through those, Lindsay?
Sure, yeah. So the first one, and we were not thinking of tackling all these at once. We were thinking, gosh, we could work on like one a meeting. I mean, it's going to take some time, put it together. What should be included in the scope of the board. First one was public health policy and development. I think what we need to do here is, and we've already discussed it today, emergency plan reviews, working with DES on like where are we at when things hit the fan, right? What's our role?
It's on 9.
And,
I think 9 is emergency preparedness.
I have it down here twice.
Oh,
That's all right.
That's
We'll
okay.
get there.
That's why this is a rough draft.
Yeah, it's a rough draft. It was just ideas. But thank you.
Yeah.
So we're looking at part of like reviewing emergency plans and then just what needs done regularly. And we've talked about a lot of that today. Health education and promotion. We also discussed that a little bit today, just working with partners, community partners, school. Basically, what do we want to say in our strategic plan about how we partner, who we partner with, and what we do with the partners. There's that ticker on the website. I see it.
Yeah, that was my idea.
Disease prevention and control. Environmental health. Obviously, we were talking to Megan about that. So working with the sanitarian, what we oversee, this is all part of our scope, right? So health services oversight, community engagement, again, we mentioned that earlier, data collection and research, that would be things like the CHA and the CHIP coming from public health. And I skipped a number there, sorry. And then again, emergency preparedness. So we felt like all those items were things that should be included in the scope of the Board of Health, just based on what we learned at the Confluence. And then our strategic plan, as we move forward, supports that scope.
Yeah,
So
that's what we were talking about. I think that
makes
we would
sense better.
take like section 1 and talk about public health one meeting and how we would support public health in one meeting.
Yeah.
And then this may not be all inclusive. We could, I mean, if there's other things we think should be included in our scope, like what we want to cover as Board of Health, we could continue to add to this list. It was just a starting jumping off point. So open a conversation on if we need more items and things that we want to cover under our scope.
And I think we envision that strategic plan almost like Ruby's talking about some of her plans, but we have, but simplified. It doesn't need to be a lengthy document. You know, it supports our scope. You were saying goal for completion like next February. Just take some time to go over it. We can use the data from the CHIP and the CHA. And we'll know more about what a strategic plan should technically look like for the Board of Health. I think we can research that a little bit more.
Is there any more avenues that this group would like added to the scope besides education, disease prevention, environmental health, health service oversight, community engagement, data collection, and emergency preparedness? Is there anything we were forgetting?
What is health service oversight?
Health oversight.
What was it?
May oversee local health departments and ensure access to essential health services, including maternal and child health, mental health, and substance abuse services.
Okay.
And that was just a general.
Yeah.
Essentially helping guide what they want from me as public health.
Ruby, can you come back up for a second? Sorry. Thank you. We were just discussing how we can be a better partner to public health all the way around, how Board of Health can help you.
Yeah. Just based on what I've heard from other counties' public health, because I do like visit with a lot of other public health offices in the state. They have very involved Board of Health, like a very involved Board of Health that helps them set policy and procedure for what they do and like helps plan things. And so like I would love for that to happen to some extent. Like I don't need total oversight or anyone to like baby me by any means, but just having more engagement with you guys and knowing that like if something crazy comes up, like I have support from the board and which I know I do, but it would just be nice to have better communication, maybe is what I'm thinking.
Just a better partnership. Yep, I agree.
So looking at this, I guess, gentlemen, do you guys have any thoughts? Please chime in, because we're chattering away here and trying to remember everything we put down, because like I said, it's been a couple months. So.
Well, I'd like to suggest that maybe we have a meeting outside of our board meeting here where we look at emergency preparedness and pick a topic like clean water. You know, what would happen if we had, we got a new water tank coming in and stuff. What happens if we had a citywide contamination? How are we going to deal with that?
And that's something that FEP can help us with too, is setting up like tabletops. Like that's essentially what you're describing is like a mock scenario in which we test our plans.
Yeah.
So like this year, FEP has us doing a highly infectious disease tabletop, and so it's based off measles. And that I think is happening next week, and I can get you guys the link if you'd like to attend that as well. But the tabletops are really great, honestly. Every time I've been to one, I really enjoy it, and you learn a lot. And you
I was just thinking about just the steps going through, who you got to get a hold
and that's
of.
and that's exactly what you do at a tabletop. Is you look at your plans and you see how easy it is to get through them and like what you can reasonably accomplish in a situation. Like,
Well, it
is this
might-
going to work? Like, who do I call? Do I have to skip to page 63 of this plan to find who I need to call?
Yeah.
Or is it marked clearly where I need to skip to? Or that sort of things, like logistical things that help make a crisis situation manageable.
Yeah, identify some
Mhm.
problems that you don't even think about.
Mm-hmm.
Yeah.
Yep.
I think my understanding though is it would have to be open to the public, right? Anything we do as the board would have to be.
Yeah, usually
Yeah.
if all board
Well,
members
and if
are
we're
there,
going to do
yeah,
like a
for sure.
tabletop, we should do it in conjunction with LEPC too.
I agree.
Agreed.
So it can be something that we work together with LEPC to plan for next year. And FEP has pre-planned tabletops and stuff like that, so they can come in and help us from the state side.
Yeah, no sense reinventing the wheel. Somebody's already been doing
Right.
it.
Yeah. Yeah, so there's definitely things we can do. There's other, like the dam, they did a tabletop on the dam if that were to rupture a couple years ago. So there's lots of like preset tabletops and like exercises that we can definitely call and get people in on. And I think just as the Board of Health, because it was usually like an LEPC exercise. And so I don't think Board of Health has ever really been thought of to be invited. And so maybe that's just education we can work on with our new LEPC chair whenever that's figured out, or however we're going to do that with DES. And just make sure that we're all on those lists for people to contact. But that, I think that if we're going to do a tabletop, we should do it as one group with LEPC, Board of Health.
I think it's a good idea.
Anything,
Yeah.
Yeah.
Anything.
And we can maybe start looking at that and what we would like to do, like what scenario we'd like to do, and discussing that with the LEPC, and like getting it on the books for sometime,
Spring?
yeah, probably spring. It takes a minute to get those organized. But they have a whole, like 4 people at the state who just do this. They also have like a board game option, which is kind of fun. That you can do like a point of dispension, which is like a mass vaccination clinic, a mass medication clinic, something to that effect. And they have one that is like a disaster preparedness situation. So they've got several options for us to, and that one we could do more as like just a Board of Health, because that one I think you can have like up to 8 players. And it would just give you like an idea of what our plans look like, and it's kind of a fun way to do it, but it takes like 2 to 3 hours. So it's a commitment also.
Simulation Montana would be a really good
Yes,
option
they're
also.
I did
awesome.
one here. I did one with them.
Yeah.
Mhm.
They did a
Marburg.
Marburg.
Mhm.
That's what the one I
Outbreak.
was with. Yeah.
Yep.
Oh, yeah.
They are awesome to work with too. And the oh gosh, Montana Public Health Coalition, I think it is. They do a tabletop exercise every year too, that anyone can join, and so we can look at getting in on those too.
What would be interesting is to see like how to put it like if there's one of those exercises. Here's the scenario. Here's what's happening. What does the board need to do as a board? Like, what is our role? How do we what do we need to work on and address things as opposed to individuals, right?
Yeah, and that's essentially what you do.
Yeah. That would be ideal. Even one a year would be great.
Yeah.
To do.
Yeah, there's definitely
Okay.
several options that we can look into to get all of us together to do that.
Start small.
So looking back, and again, you guys just forgive me because these were like our working meeting notes, and they were just pretty much as we were throwing things out, they were coming together. So if you're looking at the scope, and we have all these numbered items in the scope, in preparation for the next meeting, would everybody take some time to just look over this, see if there's anything they see that they want added? Okay, are we missing something? Is there a topic? I mean, we numbered out some topics, right? Some of them overlap a little bit. But is there anything they'd like to see in there that we think we're missing?
Well, Madam Chair.
Yes.
On number 6, community engagement, you mentioned earlier that was brought up. Maybe inviting somebody from one of those groups to come to our meeting and just give a 5-minute presentation on what their organization is about or what services they have to offer, so that we can become better educated. And that's using some community engagement.
Yep, absolutely.
Just have them come, to the meeting.
Yeah. Well,
Get to know who's who.
I agree. I think that's a good idea. I think it's a good idea. I think we haven't, like you said, it's been pretty stagnant since COVID, so we might as well start working on some things and get moving in a direction. And I will look in to see what other boards of health use, what like a strategic plan looks like from another board of health. I'm just curious, is it 150 pages? Is it 10? Like, I don't think it does anybody any good to have a really long, lengthy document that no one will ever read and never update because it's so long.
No, and strategic plans, from what I have seen and like been a part of, are more like a box chart essentially. Like you have your topics and then you fill in what you need for them, and it's not necessarily a super official looking document.
No, you'll have like your topic one that's in your scope and how your strategic plan supports that tier.
And my recommendation would be to maybe call Jeffco to get theirs, because they're the most similar to us.
Okay. So I can bring that next meeting. Everybody look into 2 ideas, like a mission statement and then a link or a fun fact that we could put on, like a seasonal fact. And then I would say maybe take some time to look at these items, these numbered items under scope, and think about, is there anything we need to add? Do we need another item under there that we're completely missing? And if we want to add to these current ones, we can. And then maybe we take some time to just pick one and really develop one idea as we move forward, as we have a better idea what the plan looks like and what we want to see come together. So just make sure we're not missing anything, and then come up with some ideas, and we'll get rolling at the next meeting. It sounds like there may be a possibility. No, that wouldn't come to the Board of Health if there is an easement request. No, okay, never mind. Just a variance. We're not, okay, never mind. Scratch that.
JK.
Is there anything else you would like to add?
Nothing I think of.
It's like, you'd be excited. We're planning.
Yeah.
Do some things.
Just doing something. I know. There's a lot going on. So I appreciate everybody coming back, and I'll try to have a thorough agenda that just gives a better idea of what we're doing specifically for each agenda item. Right. Anything else? No? Okay. Nothing? Nothing else for the good of the order. All right. I'll call this meeting adjourned. I have to use the